this industry for many decades. It's an honor to have you on this channel today, Leona.
Thank you. Thank you, Locke, so much.
Let us know a little bit about your background. A lot of us, I know that you are not only the practice system analysis developer, practice advisor, you coach, you also an innovator that you can turn the protocol of any practice, whether it's medical or dental, into a system where it can work for 100 to 1,000 of practitioners. Already been since 1979, I understand. And you led the major dental practice management consultant company for 10 years. And you have done so much in dentistry and also medical. So please, it's an honor. I want you to just give us a little bit more, introduce to my audience. Now, our conversation today is more focused on how do we pick the right consultant, and how do we know when do we need a consultant company help us? So, Leonora, the show is yours. Please tell us a little bit more.
So, dentists are sort of like patients. They don't ask for help till they're in pain. So your patient will wait until they're just, and then they'll be an emergency patient. Well, consulting is the same way. The dentist will wait till they have symptoms, and then when they can't stand it anymore, they call a consultant, and they don't know who to call. They don't know how to vet them, how to talk to them, what to expect, and they spend a lot of money on consulting. And so, but they don't really know. They just know they're in pain. And so what I've done is, since I understand dentists weren't really trained in organizing a dental practice, they were trained to be a dentist. So what I saw is they usually get out of dental school and go to work for somebody else because they've got loans to pay off. So when they go to work for somebody, it's usually a clinic or maybe a corporate owned business. And so they work for that for a while, and they don't like it, and they want to go into private practice at some point. Usually it's about 2 to 4 years. So they've now proven they're not going to hurt somebody, right? So so now they can get a loan, and they're going to get a loan for about nowadays $700 to $1 million for a small practice, even, right? On top of their student loan, probably like $500,000 to $1 million. Right, exactly. So that's where they're starting, and they basically copy what they learned in the first place that they worked. So if they worked for a clinic, they're going to build a clinic because that's all they know how to do, even though they didn't like a clinic. So they end up in this vicious cycle of never really creating what they want. So the first step is to help dentists understand the steps to know, first of all, do they even need a consultant? Second of all, is now the right time for it? And thirdly, what is the recourse if it doesn't work? So what I developed, I like you said, I've been in over 1,000 practices in my lifetime, border to border, coast to coast. So I learned how to do an exam. I created an exam of the practice. No self-respecting dentist would give a treatment plan to a patient without doing an exam. Even if it's a cursory exam, they would do an exam. Well, that's what I do too. I would not give a dentist and say, you need this or you need this, until I did a cursory exam. So that's where a dentist should start. And just like you have, not a cursory exam, a full exam, just like you have a full exam like every, so often, year, 2 years, you go to the hygienist every 6 months, you get checked out. Having an exam process that you can do yourself, you can diagnose yourself to see if you need help. And the idea is to prevent issues, which will cost you a whole lot less than waiting until it's an emergency and then expecting the consultant to wave a magic wand and fix everything.
Leona, I like how you related the connection between the position of a dentist working on a patient and the same thing at the position of a consultant like you, who have done and experienced so much with different dentists, and you already have you almost like a doctor who looking at the practice and go like, okay, you know what, let's talk, let's find out who you are, let's work it out. And I also like the idea that you gave us an idea that it seemed to me like anybody can also benefit for a dental consultant, whether you are a few years out or you are 10 years out or 20 years out, or if you want to work for another 10 more years, 40, 50 years. So everybody needs a consultant, but we need to know when should we go in and who should we approach, because it's just everywhere. But that's what your expertise is, to diagnose that's clinic, that's doctor,
Yes.
that's personality, person, like who you are, you know, what do you want, you know. So that's what I can see that your vision.
Yeah, so what we're going to talk about today is the steps of that exam process. And once they know the steps, it doesn't matter who they work with, they're going to get good results. If you wait and you join a practice management program, you're going to pay 20 to 40. The one I used to work with charges $50,000. That's what I used to, you know, bring in. And so if you wait that long, you're going to spend a lot more money. And that if you prevent, maybe you only need help in this area. We don't need to do a full mouth reconstruction, right? If you're doing well in every other area. So I put together a gift for your listeners today. It's called a skill wheel quiz. And if they can write this down, it's they can get it two ways. One way is just message me, just text me your email so I know where to send it. And so that is 480-225-0700. The other way is go to gowellnet.com. Go as in opposite of stop, well as in opposite of sick, net as in fisherman's net, network. So gowellnet.com/quiz. And they'll get the quiz, and then I will spend an hour complimentary as a gift from you, really, for having me here, to be able to look at that and say, okay, this is my strategic plan for this area or that area. And so there are certain symptoms that you need to be aware of, the dentist, your dentist need to be aware of. So I'm going to give you the symptoms that are common. Okay.
Yes.
So the first symptom is team turnover. Team turnover. An average team member should be staying with you for 2 to 3 years. If you're turning them over faster than that, and they're not leaving because they're having babies, you know, you've got an issue. You've got a systems issue. Okay. And so conflict, team conflict, recruitment, that you don't know how to recruit or onboard team members. Those are by far the top motivators that help is needed.
It sounds so familiar. You can stop right there. It sounds so familiar. Like I got a symptom, you know.
And then the question is, to what degree? Right. You can come in and say, oh, I'm in pain, doc. And then you take an x-ray and you're like, oh, it's okay. You know, it's not you don't need a root canal, you know, got a leaky filling or whatever it is. Right. So there's obvious pain symptoms. But there's 4 areas that recurring issues fall into. So one of them is time. The dentist has no time. The team's complains, I don't have time to finish. So not enough time, not enough money. You can be making a lot of money, but not enough profit. So when I say money, I'm talking about not just production or collections, I'm talking about bottom line profit. And then quality of life. So if you're stressed and you're like dreading going to work on Monday morning because you're so, you don't want to go back into the mill, so to speak. We got to have a conversation. These are dentistry should be enjoyable. It should not be stress, and it can be if you just know how to structure it. And then the quality of patient care. A lot of my clients come to me and they say, I don't need the money, Leona. I got plenty of money. My team's been with me forever, but I see a lot of health issues that I should be taken care of that I'm not able to because the patient won't accept the case, so we don't know how to present it. So there's a lot of different things you can look at. So the first thing the dentist does is sits down in a quiet space and lists, these are the time issues I have. These are the money issues I have. This is the quality of life and the quality of patient care issues that I have. And then rate those 1 to 5. 1 being, oh, it's a problem because I had a patient yesterday, that had that problem, but it's not really a pattern. 5 being, oh my gosh, this happens every day. So you can rate it 1 to 5, and that helps you to know how much help you need. Okay. Right. So those are, and if you can do that before it gets to be critical, and you need that full mouth reconstruction, it's going to cost you a lot less, but more importantly, it's going to be less stressful to manage that change.
Most dentists, it's just like any other profession, but I think I found like, healthcare professional people, some of us have the personality where we obtained this, we went to school, we had so much schooling, and then we have this very unique kind of personality that you don't share with anybody, and you work so hard. And then you still cannot, even you have your office, you have everything, but then something happened in your office and you don't even have a good friend to share or even somebody to really share, because everything you say, it just maybe like, it's just, oh, how come you just, that's how bad you are? or what's going on, right? So we have some of us have the internal conflict issue. We don't share with anybody, and we just struggle and struggle and struggle and struggle. So yes, I agree. I like.
Yeah, the other to build on what you just said, what do you share? How much is too much? So finally, you get somebody like me that asks you the right questions, so that you can share what is helpful, not chit chat. Right. Because one of the things I've noticed, dentists don't have a lot of time to chit chat.
Right.
So, I'm going to get to the point, ask specific questions, and listen more than I speak. I'm talking a lot because you're interviewing me. But when I'm working with a client, I ask the questions and then I'm quiet and let them answer, because their answers tells both of us. The number one thing is they don't know what they want. They don't even know it's possible. So by asking the right questions, they start to go, really? I could do that? How long would that take me? Well, doctor, I can do it in 3 months. You're kidding me. I've been trying to do this for 5 years, So having somebody guide you in the right direction. So those are the obvious pain symptoms that that I, just listed.
Give me Leona, give me an example of something that you worked before that you recognize that at a dentist, we surprised when you say, yeah, you can get this 3 months, 6 months, or a year from now. Are we talking about the financial goal or something else?
Okay, yeah. Very good question. It depends on what engine we're working on. So when you look at a practice, these are the engines that run the practice. The first one is finance. So if you are not saving 10% of your collections every month until you get 3 months of your bills in the bank, you got to fix your budget, you got to fix your collections, you got to fix your schedule. Something's causing that. So finance is one of the engines. And in this skill wheel, we have 10 questions for each of these 5 engines that I'm going to list. So I will say, in the finance engine, do you do this? And you'll say, oh, some months, but not every month. That would be a 3, right? Or no, I don't even know what you're talking about, Leona. You're coming from Mars. That would be a 1. And a 5 would be, yeah, I've nailed this. This is working for me. So it tells me where the best place to start. What's your fastest path to results? So there's finance, and then there's marketing.
Okay.
Marketing makes the phone ring. Is your phone ringing, right? Then you have sales. From, is the schedule full, but you're not able to get anything more than what insurance covers off the shelf, right? So that would be sales. And I have analyses for each of these as part of the exam. So if you do the skill wheel, you're the first 10 that request the full practice exam, I normally charge $750 for it. It's free to them, the first 10. Okay, everybody can get the skill wheel, but the first 10 that say, I want an exam. So we look at finance, and there's certain key performance indicators that we look at, and it tells us the patterns of what's happening. So we have finance, marketing, sales, operations. Truth be known, most of the consultants with dentists work only in operations. They don't work with much else, okay? But operations, front and back office, is key for systems, right? Because it kind of influences everything else. So you have operations, and then you have human resources. So there's ways that we can measure each of those engines and say, okay, Locke, this is your strengths. This is the weaknesses that you have. This is the which engine you need to work on this quarter, and you only get to pick one. Okay, now does that say somebody quits during that quarter and we're not working on human resources? No, we're going to work on human resources because that's urgent, right? But our plan is to get certain things, systems in place per engine based on what we choose.
Got it.
And so an example, I had a client, one of my best top clients. He's been working with me for almost 10 years now. Not everybody does. Some people only work with me for a year. It's, it depends on what their issues are. But he's what we call a level 4 practice. I'm going to explain that in a minute. But all he wanted to do when he came to me is be able to take off work to pick his children up from school. That's all he wanted. He didn't have any other symptoms, no big stress issues. He just wanted to be able to take off in time to pick up his children without losing the money he was making by working the way he was. And we were able to do that in probably, well, we did 2 things. First 3 months is we worked on scheduling. That was our main operations thing. And then we worked on sales. His average sale now is $40,000. He's an implant guru now. He wasn't when I started with him.
I see.
So that gets back with what model are you trying to build? So there's basically 4 models in dentistry, or pretty much business everywhere. The level 1 is the emergency room or the clinic of the industry. So this would be, they do mostly emergencies. Their average case is going to be $500 because they don't deal with insurance, because people that come there don't even have insurance. You get the point. That's the hospital of dentistry is a level 1. Well, if you have an average case of $500, that's really different than a level 4, which the average has to be 10,000 or more average. Okay, so the model you pick is defines everything that we do. So we have 2 different ways to look at that. One is, this is the model I have, and the other is, this is the model I want. Most dentists are in level 2. I would say 90% are level 2, which is fill, drill, and bill. If insurance doesn't cover it, we don't do it. Okay, that's pretty much most dentists, but they hate it. They really want to be less insurance driven and they want to be more level 3.
Yeah.
So a level 3 uses insurance. It's not like we're going to get her out of insurance, but it does it. The average case is 5,000. Okay. So we can look at and determine what do you have and what do you want, and we can measure the difference, and then that gives us our goals. Now, I am so confident when I set goals, when we go through this process log, I will guarantee those results, or I will work with you for free until you get them. So if you wanted to increase lower your overhead by 10% by increasing your case acceptance, and I says, okay, your case acceptance is this right now, and I'm confident in 3 months we can get them there, and you go, great, Leona, let's do it. If I don't, I'll work with you for free until you do. I do not commit to a goal. So I have as much skin in the game as the dentist does.
So guys, you listen to our conversation. Leona is a dental consultant. So she specializes in fixing up our practice, whether you're a beginner to or seasonal dentist. We all have our pathway of success, but depend on what kind of success that you are determined or you have a vision for. She is specialized in helping us. So this conversation is actually not only helping a beginner or a seasonal or, you know, somewhere in between, we all need it. So I'm very happy to have her to, you know, just go overall some kind of conversation. So when you listen to us, you have an idea that dental consultant is whether it's fit for you or not, but it's we all need somebody. So that's the bottom line. So please continue, Leona.
Okay, well, thank you, because you brought up another thing, and that is the growth phase that they're in. So the exam is the same, no matter if you're a startup, you're in what I call adolescence, which means you're growing like a adolescent boy, you're growing really quickly, or whether you're in maturity or if you're in decline. Yeah. So we can measure that, and the easiest way you can measure that for yourself is look at your last 3 profit and loss statements. Mm-hmm. If your collections have not increased, and I know 2000's behind us, but you know, I know 2000's everybody took a hit, but 2000 to 2001 you should have increased by 15%. 2001 to 2002 you should have increased by 15%. 2002 to 2023 23 you should be have increased by 15%. So year over year you're increasing 15%. If that tells us you're in that adolescence growth stage. We always want our business in that stage. So if we're not in that stage, the consultant's job is how is the fastest way to get to growth. Okay, it could take 3 months, it could take a year, it depends where you start. Right. So when we look at the growth phase, normally startup to really when it starts growing, the adolescence phase from infancy to adolescence is about 2 years. And then infancy, adolescence to flatlining is about 10 years. Because this is what happens. You have too many patients and you need to outfit another room. You need to add an associate. You need to hire another hygienist. Right. So what just happened to your costs, right? Exactly. So if you flatlined in your growth, it's going to be focused more on sales and budget. And budget is simply, this is the model I want. So for example, if you're going to be a clinic and you don't need a hygienist, you can get 50% or less overhead because, you know, you don't need as many team, you know, all of that. So if you are in a level 2, the national average for a level 2 overhead is 70%. Wow. So if you're a level 2, I would want to get you to 60% minimal. And I don't care if you work with the major names, Blatchford, Schuster, Coyce, I don't care who they are. They're real excited if they can get you to 60% overhead. Okay. So if you're a level 3, where you're doing a comprehensive exam, you're meeting with the patient and doing a consult before you even put them in an exam room, you're not doing hygiene on the first visit. You know, there's certain things that dictate level 3, and the average case should be $5,000, but you can have an overhead of 50% on that, even though you need a hygienist, typical 5 employees for that level 3 practice. Level 4 is where you're a specialist, even if you're a general dentist. Like the client I was talking about is an implant specialist, even though he's a general dentist. So they're expert at one particular field, no matter what it is. So, so pick your model. What are you trying to create? Pick your model, and then we'll figure out what model are you in now. Because you can want one thing, but what you have may be completely different. And measuring that gap tells me how long it's going to take you, because that's where my experience kicks in. Okay. So we've got, so the first thing is understanding which business model you're in versus what you want. Understanding the 4 business models, I just explained them. And then we look at the growth stage. Talked about that, increasing a minimum of 15. Some people say 20%, but because of COVID, I lowered it down to 15% increase year over year. So because sometimes you outgrow your model. You know, you started in one place, but now you have more skills. You've taken more CE, but you've not changed your model. Okay, so knowing what that is, and then measuring your skills in those 5 engines. So, so that starts with the skill wheel quiz.
Wonderful. Wonderful. I like that. Thank you for giving us the overall picture of how you dissect and analyze the office and figure out what they want and what their vision and all of that. I understand you also have a company that have a very good name. It's called Clean Kiss. Would you give us a little bit of information about the company?
Yeah. So what happened is I worked in practice management for 10 years. And then I worked as director of development for Centers for Dental Medicine. So I brought the first CO2 laser into the United States for perio. And people laughed at me when we did that. They didn't, because it wasn't proven yet. Now you use a diode, you don't even use the CO2 unless you're doing other things. But at that time, there was no diode at that time that was used in dentistry. So I introduced that there, and I thought, oh my gosh, periodontal disease is going to go away, and this is the end of it. And wow, you know, this is better than sliced bread. And it does work wonderfully. It ablates the dead tissue and it heals miraculously. I don't know if you use a laser, but
I do,
it's great. But what happens is, unfortunately, the patient eats, drinks, and breathes. And when they do that, when they eat, drink, or breathe, they bring in bacteria. Some of those are bad bacteria, some of those are good bacteria. So what happens is we noticed that it would come back. So they get them all cleaned up, and then usually about 2 years later, it would come back. So I realized that there had to be more change in home care. So I did case studies on a couple different types of home cares that's really well known, and they just didn't work. They did not kill the bacteria. They didn't, that I could measure. They didn't work. So I created my own. And one thing that I wanted to do, I worked with a naturopath, a chemist, a physician, an MD, and about 5 of my key dentists. So we knew what we wanted, and it took us 3 years to put Clean Kiss together. And so it's organic oral care that it's organic oral care that the mouthwash oxygenates the mouth. That's how it kills the pathogenic bacteria, and it creates a good environment for the good bacteria to grow in. And then the toothpaste does not use fluoride. And some dentists won't even talk to me if I don't have fluoride in it. But what I've done is I use vitamin B12 instead of fluoride. Vitamin B12 breaks up sugar, no decay. So this is guaranteed. You use it for 3 months as directed. If it doesn't work for you and you go to your hygienist and the hygienist says, nope, no improvement with you, I'll give you your money back. I'm very much about standing behind what I do, whether it's a promise for consulting or a product, right? So Clean Kiss is the product that my company HCP WellNet produces. And then the third piece that I do is so let's say that you like my patient care. I understand the oral systemic connection, but I don't know how to implement this. I can't get patients to buy into it. So it's a loss leader for me. I'm not making any money doing it. And I can't get the team involved. I interviewed 140 dentists that went to AOSH, American Academy of Oral Systemic Health. And they told me what their roadblocks were. And I have a mastermind once a month. And if you're interested in that, text me and just put mastermind in your email address and I'll make sure you get an invite. Okay. But what it does is it teaches dentists how to integrate oral systemic health, starting with periodontal disease, putting that in remission into their practices. And it creates a $10,000 a month revenue stream. Wow. Without adding a hygienist, without extra chair time, and without, a whole bunch of expense. So yeah, if you do the system that I put together for oral hygiene, sometimes that's the sales bump you need in your overall practice management. You now have residual sales that the dentist doesn't have to do anything with. The team manages it, and it averages $10,000 a month in revenue. So and I guarantee that as well, or I'll work with you for free. So those are the three areas that I work with. Is full consulting, and the Clean Kiss products, and the oral systemic health implementation or integration into your practice.
I'm curious about the Clean Kiss product. I saw that you have the toothpaste and then you have the solution and also the spray, right? 3 items.
Yeah, I don't have the spray anymore since the pandemic. I need to change that on my website. But I have the mouthwash and the toothpaste, and then I have 2 nutraceuticals. One is for, now not everybody needs the nutraceuticals, but they're there if you have rampant perio, class 3 perio. Okay. Because if the patient's bleeding, the bacteria is getting into their body. Yeah. If it gets into their body, it's doubling their chance of heart disease, diabetes, preterm birth, Alzheimer's, cancer, all those systemic diseases. So you want to help avoid systemic issues. The mouthwash and toothpaste clean the mouth up. I also have added an oral probiotic to the system just recently. And for those people who just won't brush twice a day, there's, some people just won't, they're not compliant. So if they don't brush twice a day, they're going to need some other help, and the probiotic helps them with that. So I put together this system of oral care. Here's osteotherapy is for bone health. Perio care is for inflammation. Those are the 2 nutraceuticals. The Probiora is the probiotic, and then the mouthwash and the toothpaste. And so that's part of it. But the other part is helping the patient understand they have a problem. And so we do A1C CRP tests on our patients and vitamin D tests. So you can get those off my website as well.
So the A1C test, you test in the blood?
Yes. So it's a finger stick, that
Uh-huh.
any dental assistant can do in the office. You don't need extra licensing or anything like that. Send it into a lab and you get 3 reports from one finger stick.
Mhm.
You get an A1C report, which measures leftover glucose in the bloodstream. You get a CRP report, which tells you how much inflammation you have in your body. And then you get a vitamin D report so that you can see, especially if the person's going to get implants, you know, you want to see if they have enough. It's a supplement to help them with protect their bone.
So with the A1, I'm just curious about the A1C test. You do the blood test, and you can also is that test in kit including the vitamin D as well, or just a separate test?
Yes, you one finger stick, 3 test results.
Wow.
Yeah,
Wow.
yeah. So and then the other thing that we test for is the actual red bacteria. This is an inexpensive test. It's the BANA test that it's listed there. And it just tells us, it's like a pregnancy test. It just tells us, do you have the red bacteria or not? So the strip will turn blue if you do. It won't turn that color if you don't. Now, most people, hygienists can predict who's going to have it. It's not for the hygienist. It's not for diagnostic. It's so the patient understands. Okay, I have this bacteria in my mouth. So, you know, it's for them to understand. It's not for the hygienist to understand. Because if they have more than 6 4-millimeter pockets and they're bleeding, they're going to be positive on the BANA test. You know that. So it's not for you, it's for the patient. And then the last thing that we do is we do the HR5 test so that we measure all of the bacteria, but that's a more expensive test. So we don't do that until they pay for the therapy. So we do like orthodontics. Orthodontists do not charge you per visit. They say, yep, you need braces and it's going to cost you $6,000 over the next 2 years. So it's the same kind of thing. This is going to take a year to put in remission. Everything you need is included: the laser, the testing before and after, the home care, everything you need, patients intact. And the typical fee, and once I train you, you'll get 50% or more case acceptance of a class 2 is typically around $3,000. A class 3 is typically, and that's for a 6-month program.
Leona, can you repeat? So are you talking about the BANA enzyme tester?
I'm talking about, you put a case together. So you use the BANA to just get the patient's attention.
Okay.
You call them back and you do a hygiene appointment. I mean, you do a probing, and if they've got more than 6 4-millimeter pockets in their whole mouth, you're going to call them back for a review of findings, and you're going to do, before they leave, you're going to take the A1C CRP test.
Got it.
That's what you're going to do. Then you're going to bring them back and you're going to present their treatment plan. It's going to be either a 6-month plan or a 12-month plan. And you're not going to itemize. The patient can't say, oh, just give me the laser. It's the whole program that they need to accept. So you present the whole thing. So a 6-month program typically costs the patients $3,000 nationally. That's an average. And then the 12-month program typically costs $4,000. And you will get over 50% case acceptance if you follow the process that I teach. So you do not present treatment in the hygiene room when the person came in for a limited exam. You know, when they come in for a limited exam, you do an assessment. You don't charge them for it. Call them back for a review of findings, and then you lay out the treatment plan for them. And then as part of that treatment plan, you also include the HR5 test, which measures the 5 dangerous bacteria, not just the red bacteria, but they'll measure 5 top bacteria. So you do that before and after, so you can prove to yourself and to your patient that it worked. So I covered a lot more. I wasn't expecting to cover this much. So thank you for listening.
Well, it's awesome. A lot of your product, I'm hoping that we can have another time to go over and explain. People might ask, like, we see so many dental product on the market. What is so special about your oral care product? Can you go explain a little bit about
Yeah, absolutely.
Yeah.
Absolutely. So first of all, everything, there's no chemicals in it.
Okay.
Everything, so there's essential oils, things like apple cider vinegar, things like coconut oil, things like aloe vera gel. There's 13 ingredients that in the mouthwash alone that oxygenate. They kill the bacteria 3 ways. The first way is they wrap, the oils wrap around the bacteria. You might have heard of coconut oil pulling. It's the same concept. So when you gargle with it, it wraps around the bacteria and you spit it out. So
Any flavor? Any flavor?
Yeah, it's not as it's not really minty. It's more, people really like the taste. It's more kind of a fruity, but it's stronger. It's a strong fruity. It's hard to explain, but it's not like, there is peppermint in it. You know, there is mint in it, because that's a good anti-inflammatory. That's a good, it kills the bacteria really well. The first way it kills is wrapping around so you can spit it out. Second way it kills is it oxygenates the mouth. The pathogenic bacteria hate oxygen. So if you oxygenate the mouth, you're killing the pathogenic bacteria. Okay. And you're also not hurting the good bacteria. It doesn't kill everything. It just kills. So that's something really special about it. A lot of people are saying don't use mouthwash now. They just don't know about Clean Kiss. You know, they're talking about chlorhexidine or Listerine or Scope or something like that. But this actually promotes creates an environment so that the good bacteria that aids in digestion and all of the in the microbiome, the good stuff, it leaves that alone, but it oxygenates, which kills the bad bacteria. The probiotics, now that you've got this oxygenated mouth, if you're a class 3 where you have 5mm pockets and loose teeth and it's really advanced, the probiotics, or if they're non-compliant and they don't do it twice a day, pop that in, let it dissolve in the mouth. It's like people think of it like a breath mint, but it's not. And what it does is it's freeze dried good bacteria. And so you've oxygenated the mouth, which makes it a perfect place for good bacteria. And then you've augmented your own good bacteria with the probiotics. So that really is a nice addition to that. So
the probiotic, does it help the intestinal system as well, or just the teeth?
Yeah, no, that's a really good question, because there's different types of probiotics, and most probiotics are for the digestive tract. This is for the oral cavity. We're not about I wanted to limit the probiotics to the oral cavity, because if you have too many of them and the patient doesn't tolerate them well, you don't know which one. So if they have digestive issues, that's a different issue. You don't want to put them both together. So it won't hurt to do them both together, but I'm just saying, I chose a probiotic that specifically was for the oral cavity.
So usually you order a product, you rinse and you spit it out, right? You don't swallow anything.
No, you rinse, spit it out. You put the rinse in your oral irrigator, a couple capfuls. It won't hurt whichever one you're using. It works fine. And so you're getting the mouthwash under the gum line. where you may not get it if you just swish. And then you brush. You brush last because the pH of all of these essential oils and all of this fruity stuff is a very, it's a low pH. So it's like a 6 pH. Well, you want a 7 in your mouth. So when you brush with the scrub toothpaste, it has an 8 pH. So it balances that 6 and you end up with a good finish. So you want to brush last, not first. Yeah. So that's if anybody's interested in just Clean Kiss, they don't want practice management, tell me when you text me 480-225-0700. Tell me when and you can't get that phone number anywhere else. It has to be from your people.
Okay.
And so text me product or OSH for oral systemic health system or overall practice management. But either way, you'll still get the quiz. Okay, so that you can start with that. So anyway.
So awesome. So awesome. Thank you very much. It's an honor and a privilege to be able to talk to somebody who have a lot of experience in both, dental consultant and also dental product. Leona, thank you again for coming on our show today. And I'm hoping to see you again and enjoy your night. Have a great day.
It was fun. Thanks, Locke. And anytime, just let me know what you want to talk about.
Sure. All right. Talk to you later.
Bye-bye.